Hello everyone and welcome to the RX Masterclass. Whether you're a pharmacy student gearing up for the exam, a seasoned pharmacist looking for a refresher, or simply someone curious about the ins and outs of pharmacy, you've come to the right place. Stay tuned to uncover everything you need to know about general pharmacy practice for the CPJE exam. Let's make this journey informative, enjoyable, and most importantly, successful. Let's get into it. In this video, we'll be covering the following key topics: prescription fundamentals, medication substitutions, pharmacist's consideration of religious, ethical, and moral issues, dealing with unavailable medications, providing information to consumers, and off-label prescribing. Starting off with prescription requirements, this includes hard copy prescriptions, fax prescriptions, and electronic prescriptions. Controls need to have the date written in the prescriber's handwriting. The signature of the prescriber is needed. And for controlled substances, the signature and date needs to be written on the prescription by the prescriber. Phoning in prescriptions for electronic or oral prescriptions, these must have the name of the person transmitting it, pharmacist or intern pharmacist taking in the prescription, and it should be rewritten on the prescription pad and stored for 3 years. Emergency prescriptions. Emergency prescriptions are called in by the physician in a life or death situation. The provider must mail in the prescription within 7 days of the phone-in. If the provider does not send it, then the pharmacist has 6 days, a total of 144 hours, to notify the DEA and the Bureau of Narcotic Enforcement. Controlled substances electronic prescribing. These records must be retrievable within 48 hours. A pharmacy inspector could come in and ask for a specific controlled substance prescription, and these need to be retrievable within 48 hours, so the PIC must be able to get these records within 48 hours. The DEA allowed for electronic prescribing of the Schedule 2 to Schedule 5 drugs. Prescribers and pharmacies need electronic medical record software to use this system to be able to receive and send prescriptions electronically. An audit by third party occurs every 2 years. E-prescribing records are kept for 3 years. Schedule 2 medications cannot be faxed unless it is for a patient who is on hospice or if the patient is in a long-term care facility. Controlled substances Schedule 2 to Schedule 5 prescription transmission. Email may be used to transmit prescription from office to pharmacy. If a pharmacy uses electronic storage of records, it no longer needs to reduce prescription to writing. Receiving prescription orders, new or modified phone-in prescriptions may be received only by a pharmacist or an intern pharmacist. Non-controlled prescription refills can be retrieved by techs or clerks. Out-of-state prescriptions. A California pharmacy can fill and dispense prescriptions directly to a patient who lives out of state. Fill Schedule 3 to Schedule 5 prescriptions written or called in by another state's prescriber. For Schedule 3 to Schedule 5 drugs, these can be phoned in from out of state and transferred to the pharmacy. For this, you would need to use a special controlled security form. For controlled substances Schedule 2 prescriptions, California pharmacies can only fill and deliver drugs by mailing them to the patient's original state, and this is done by any mailing service such as USPS, UPS, FedEx, etc. Multiple pre-printed prescriptions can only be used for non-controlled prescriptions. C2 to C5 prescriptions must be on a special security form. If it is not, then you do not want to fill it. Controlled substances cannot be on pre-printed or multiple checkoff prescriptions. You can fill more than one non-controlled medication as long as the prescriber indicates how many medications are on the prescription. PRN refills, or in other words, as-needed refills. No controlled prescription can have PRN refills. Non-scheduled PRN refills may be refilled within 1 year from the date written without contacting the prescriber. For non-scheduled prescriptions with PRN refills, these may be refillable after 1 year at the discretion of the pharmacist if the patient is not able to reach their prescriber. So it would be at the pharmacist's discretion. Deviation from a written prescription. Pharmacists can dispense less of what is prescribed on a prescription, but never dispense more. Pharmacists can never use a false name for prescriptions. In any case, such as in celebrities, if a celebrity comes in, such as Post Malone, you're going to use their real name. You're not going to use a fake name, although I don't think that is his real name. Moving on, only time a pharmacist can place false or misleading information on a prescription label is if it's for a clinical trial or investigational drug. Medication substitutions. The purpose of this is to save money for the patient. Cream and ointments are not the same, so you'd have to call the doctor to change them. No substitution on a written prescription needs to be initialed by the doctor. A DAW1 means dispense as written code 1, and this has the provider's initials next to it. And this means the prescriber wants the patient to take the brand name medication, while DAW2 means the patient wants the brand name medication. For electronic prescriptions, the provider does not need to initial the box besides DAW1. For obvious reasons, it's electronically sent. The doctor would not have a physical copy of it, so they would not need to physically initial. Religious, ethical, and moral concerns of a pharmacist. Pharmacists may decline to fill a prescription, but the pharmacy is required to help the patient get the prescription filled at a nearby pharmacy or an alternative method. Pharmacists must notify employer in writing, and policies and procedures must be placed in case that happens. Pharmacist needs to contact prescribers first before making any changes to a prescription. Out-of-stock medications. If a drug is out of stock, the pharmacist must immediately notify the patient and arrange for medications to be delivered, may transfer the prescription to another pharmacy, may return the prescription to the patient to take to another pharmacy. Next, notice to consumers. This is a poster with a pill on it located in every pharmacy, as you can see to the right. This must be posted in the pharmacy, and this allows the patients to know the rights they have. Off-label prescriptions. Pharmacies fill off-label prescriptions all the time. These are used for chronic or disabling conditions or life-threatening conditions. And that's all we have for general pharmacy practice. Thank you for watching. Remember to take breaks while studying, check in with yourself, and review clinical topics while studying for your pharmacy law exam. Please make sure to like and subscribe for more videos like this. See you next time.